Welcome to the Getting Healthier Together module on high cholesterol. This video can help you understand what cholesterol is, know how to control high cholesterol, learn more about what healthy cholesterol levels are, know what medicines are commonly prescribed for controlling cholesterol, find practical ways to keep cholesterol levels healthy, and create an action plan for yourself. What is cholesterol? Cholesterol is a waxy substance found in the blood and in all the body's cells. We all need cholesterol to live. Our bodies use it in many of its normal functions, but having too much cholesterol may increase the risk for heart disease and stroke. Our bodies make some cholesterol, and the rest of it comes from animal products like meats, poultry, fish, eggs, butter, cheese, and whole milk. Fruits, cereals, and vegetables don't have cholesterol. Cholesterol builds up slowly in the walls of the blood vessels, and this buildup is called plaque. Plaque can clog the arteries and block or slow down the flow of blood. When that happens, the heart has to work harder. Plaque can tear or burst, and a blood clot can form, stopping the flow of blood. Clogged arteries greatly increase the likelihood of heart disease, stroke, and other serious problems. Here's a question for you. Do you suppose that a person whose cholesterol level is too high will have symptoms? Take a moment to decide on your answer. If your answer is no, you're right. Normally, there are no signs or symptoms that tell you your cholesterol level is too high. That's why it's necessary to have a blood test to help the healthcare provider determine what your cholesterol level is. Your total cholesterol is a rough measure of all the cholesterol in your blood. Total cholesterol includes something called LDL cholesterol, HDL cholesterol, and other types. We'll be talking about each type starting with LDL. The letters LDL stand for low-density lipoprotein, and it's known as the bad cholesterol. Too much LDL can build up in blood vessels and clog your arteries, possibly leading to a heart attack or stroke. If your LDL is high, your risk for heart disease or stroke is increased. When you lower your LDL, these risks can be reduced. With HDL cholesterol, the letters HDL stand for high-density lipoprotein, and it's known as the good cholesterol. HDL takes the LDL, the bad cholesterol, out of your blood. High HDL lowers the risk for heart attack and stroke. Having low HDL levels raises the risk for heart disease and stroke. One trick for remembering which type of cholesterol is good and which is bad is to take the H in HDL and picture it standing for the word healthy. So, HDL is the healthy cholesterol, which would be the good cholesterol. A third part of the total cholesterol are the triglycerides. That word is sometimes shortened to the two letters TG. Triglycerides are another type of fat found in the blood, and a level that's too high can raise the risk for heart disease. In Part 2, we'll be talking about taking this information and using it to keep good control over your cholesterol levels. What causes high cholesterol, and what can you do to keep your cholesterol levels in a healthy range? When cholesterol is high, it can build up in your blood vessels. A blocked blood vessel going to the heart can cause a heart attack. A blocked blood vessel going to the brain can cause a stroke. There are many things that can cause a person to have high cholesterol, and some of them, such as heredity and age, can't be changed. If your parents have high cholesterol, you're likely to have it too. And as we get older, LDL levels tend to rise, especially after we turn 60. However, the good news is that other factors can be changed or managed to lower the risk for developing high cholesterol. For example, what you eat, what you weigh, how much exercise you get, how you manage stress, and whether you smoke. Here are some specific things that you can do to control high cholesterol. Maintain a healthy weight and follow a healthy eating plan that includes eating fewer animal products with saturated fats, such as red meat and dairy products like milk, butter, and cheese, and eat more fish. Eat less cholesterol by eating chicken without skin and eating fewer eggs. Include at least 5 servings a day of foods like fruits, grains, and vegetables. Check food labels to see how much fat and cholesterol are in each serving. Here's a question for you. There are 5 choices shown here: exercising at least 30 minutes a day, not smoking, taking any medicines as prescribed, lowering stress, and seeing your healthcare provider on a regular schedule. Which of these items do you suppose can help you keep good control over your cholesterol levels? If you like, pause this video for a few moments as you think through the choices, then continue playing the video when you're ready. The best answer to the question is that every one of these activities can help you lower and control high cholesterol. That's probably what you thought. Of course, the more of these that you do, the easier it is to stay in good control. The main point to keep in mind is that there are plenty of ways to keep good control over your cholesterol levels. In Part 3, we'll be talking about what the recommended goals are for healthy cholesterol levels. What cholesterol levels are considered to be healthy? The healthiest number for a person's LDL level is below 100 milligram per deciliter. The healthiest number for HDL is at least 40 milligram per deciliter, and the healthiest number for total cholesterol is less than 200 milligram per deciliter. A cholesterol level of 200 to 239 milligram per deciliter is considered to be borderline, and a level of 240 milligram per deciliter and over is too high. It's a good idea to talk to your healthcare provider about your personal risks for heart disease. The risks will help define what your personal target cholesterol goals should be. There's a handout called Cholesterol Health Card that's available to you, and it looks like this. As you can see, there's a place to write in your own goals. If you bring the card with you to your medical appointments, it can help you keep track of your cholesterol levels and see where you are with your goals. Do you suppose that your healthcare provider will mind if you bring a card like this to your visit? Might it be better to let the professionals worry about all these numbers? Feel free to pause this video now if you want to think about this for a few moments. Our healthcare providers are very aware that they can't make the kinds of real changes that can improve our cholesterol levels on their own. Showing that you want to take an active role in your own well-being makes it much better and easier for your healthcare provider to help you. Using a tracking device like this and bringing it to your appointments shows that you want to stay informed and in charge of your health. The ideal numbers for recommended cholesterol levels are different in special cases. For example, people who have had a heart attack need lower LDL levels, below 100 milligram per deciliter. Studies show that this may lower the chance of having another heart attack. People with diabetes are also considered at high risk for health problems, and they need to keep their LDL levels below 100 milligram per deciliter. People with some high risks who have cardiovascular disease are asked to lower their LDL levels to below 70 milligram per deciliter. It's important to ask your healthcare provider how often your cholesterol should be checked. For some people, it may be every 5 years. For others, their healthcare provider may check their cholesterol every year or more often. If your blood test shows a high cholesterol level, your healthcare provider will discuss the numbers. In Part 4, we'll be talking about some medicines that may be prescribed to help keep cholesterol levels under control. Sometimes, diet and exercise aren't enough to reach your target cholesterol level goals, so your healthcare provider may suggest taking medicine. If you're taking cholesterol medicine, you should still continue your meal and exercise plans. As with all medicines, you should always tell your healthcare providers about any medicine side effects. Make sure that you don't stop taking your medicines without talking to your healthcare provider. If you see different healthcare providers, make sure they know about all of the medicines you're taking. What do you suppose is one good way of making it easy to share information about what medicines you're taking? Would it be making a list and taking it with you? Would it be making a list and keeping it with your medicines at home? Would it be making sure your spouse or a trusted family member knows what you're taking? While all three ideas are good, the first one is best for making it easy to share the information with healthcare providers. Try to keep a current list of any medicines in your wallet so you'll always have it handy. The provider you see is likely to be very happy to know you have it, and it makes it easier to double-check that their records match what you're actually taking. Different types of medicines may be prescribed for lowering cholesterol levels. One is statins. Statins block an enzyme in the liver and prevent the body from making more cholesterol. Statins can lower LDL and triglycerides, and they also raise HDL. Statins may cause muscle pain or liver problems. Niacin is a B vitamin. Only take niacin if your healthcare provider tells you to. Niacin works to lower LDL and triglycerides, and it can also raise HDL. You should not take niacin if you have liver disease or gout. Some people find it hard to take niacin because it can cause face flushes. Fibric acids work to lower triglycerides. They can cause stomach problems and shouldn't be taken by people who have kidney or liver disease. Bile acid binders help rid the body of cholesterol. They can lower LDL and raise HDL, but don't have much effect on triglycerides. These medicines can cause an upset stomach and constipation. Of course, you're not supposed to memorize all of this information about medicines. This overview is just supposed to give you some general ideas. If a medicine is prescribed for you, you can always ask for more information about that specific medicine. In Part 5, we'll talk about coming up with ways to solve the typical roadblocks that can prevent us from keeping our cholesterol at healthy levels. What can we do when things going on in our lives make it hard to keep cholesterol levels within a normal range? It can sometimes be easier to come up with solutions for other people's challenges. These solutions can often give us ideas we can apply to our own situations. We'll look at 3 different situations, starting with someone we'll call Ms. Ryan. This is not an actual person. Ms. Ryan just came from her visit with her healthcare provider and learned that her cholesterol is high. Her healthcare provider recommended that she eat foods with less saturated fat and stay away from foods such as red meat and milk. Now Ms. Ryan is feeling sad because she likes to eat out and loves fried chicken, milkshakes, and steaks. Take a moment to think about what Ms. Ryan can do to eat healthy and follow her healthcare provider's recommendations. Did you think of some specific foods she can eat more of that she might like but are still healthy? Like fish, beans, lean meats, and poultry without the skin. Or maybe that she can still have smaller amounts of meat and poultry, but eat it in a healthier way by first cutting off any extra fat. Or that instead of the fried chicken she likes, trying to eat it grilled, broiled, and baked. Maybe she can try cooking with vegetable oil instead of fats that aren't as healthy. She can choose corn tortillas instead of flour tortillas. Since she loves milkshakes, she can try making them with non-fat or low-fat milk products. Did you have other ideas for Ms. Ryan? If so, that's great. Let's move on to our second scenario. Mr. and Mrs. Garcia, who are not actual people, are worried about their teenage daughter's health. She's gaining weight and isn't getting any exercise. There's a family history of diabetes and high cholesterol. Their daughter's healthcare provider informed the parents that their daughter has high cholesterol. To help her lower her risk for heart disease and diabetes, the healthcare provider told her to eat healthy, exercise on a regular schedule, and monitor her calorie intake. Take a moment to think about what Mr. and Mrs. Garcia could do to help their daughter be as healthy as possible. Did you have an idea about suggesting that they keep healthier food choices, such as fruits and vegetables, in their house? How about encouraging their daughter to exercise by giving her suggestions about walking to places when possible, or even walking just halfway and getting a ride the rest of the way? Maybe their daughter would like to invite friends over to dance to music at home after school instead of going to the local fast food place. Maybe they can talk to their daughter about how to make better food choices when she's not at home. If they encourage their daughter to start adding exercise into her daily routines little by little, exercise like walking to the store, and to invite a friend to join her, there's a better chance for success. Do you have other ideas for Mr. and Mrs. Garcia? You probably do. Let's move on to our third scenario. Ms. Johnson, also not an actual person, is a 65-year-old woman who is diagnosed with high cholesterol levels. Her healthcare provider advised her to add exercise into her week and begin walking. However, Ms. Johnson feels that it isn't safe for her to walk alone in her neighborhood. Take a moment to think about what other exercise options you might suggest for Ms. Johnson. Did you think about suggesting that she try dancing to music in her home? She could start slowly at first so she doesn't overdo it. Maybe you thought of her trying some of the many exercises she can do while sitting down. Or maybe you thought of suggesting that she find a low-intensity exercise video to work out with at home. You probably have some of your own suggestions for Ms. Johnson. Maybe looking at the challenges for other people has given you some ideas for yourself as well. In Part 6, we'll explain how you can use a personalized action plan for high cholesterol. An action plan is like a roadmap. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for high cholesterol handout that's available to you, and it looks like this. You begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the high cholesterol action plan are organized into sections, including Get Your Numbers, Take Your Medicines as told by your healthcare provider, Eat Healthy Foods, Lose Extra Weight, Move Your Body, always check with your healthcare provider before starting any new exercise program, and No Tobacco. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just one or two. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you are less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change? based on which checkboxes you've selected. The second question to ask yourself is whether you believe that it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you choose that you want to plan to get your cholesterol checked, decide when you'll do that. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life, then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you'll follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called High Cholesterol, What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in Getting Healthier Together.